Hi, my name is Dr. Mugisha Kyaruzi. I'm a cardiovascular surgeon specialist working at a university hospital and private institution. Today, I would like to advise patients who undergo open heart surgery or minimal invasive cardiac surgery in uh, in different aspects, in different aspects or perspective. Um, Before you undergo open heart surgery, you have to keep in mind that there are challenges that you will face, and these challenges they do have their solutions, and that's why we make sure that we trained you before the um, performing this type of surgery. One of them is giving the patients how to work with uh, their their pulmonary physiotherapy. The pulmonary the physiotherapists reach them, provide them with the machines to blow and increase their lung capacity, and therefore it might help them after the operation, because when you don't have the lung complication after the operation, your recovery is much more quicker, and the much you breathe properly, the quicker you are released from hospital. The patients who undergo minimal invasive cardiac surgery, we expect them to recover more quickly because they experience less pain after the operation, and because the thorax, the thorax's structure is not dismantled. The whole thorax structure is dismantled. These patients they experience less pain, and we expect them to recover more quickly. They stay, at least it's 3 to 5 days, and they are discharged from hospital. While those patients with open heart surgery, they might stay for a little bit longer, which might be 7 days to almost a week, staying in hospital for many reasons. For patients to um, to protect themselves and live the health life includes performing different type of exercises, which we call the aerobic exercises, which includes jogging, walking, and also swimming. These help them to keep the heart condition in a very good way. But also changing the lifestyle, on, which includes feeding properly, a balanced diet, and avoiding eating sugar, avoiding eating too much salt, and eating too much fatty foods, which protect the heart in many ways. The increase of minimal invasive cardiac surgery, and when more people are trained for minimal invasive cardiac surgery, more surgeons become more experienced, and in the future, we expect the rate of performing open heart surgery to decrease, but also the increase in technology, which includes the spreading of the robotic devices, 3D systems, and when these become much cheaper and they are well spread all over around the world, the rate of opening heart surgery will be much lower compared to the this period or this time right now. And also the less invasive approaches like the percutaneous interventions, which are mostly performed by cardiologists, and some are performed by the cardiac surgeons. The rate of open heart surgery will increase in the future. And awareness of most patients will also preventing them to suffer from the type of multi heart structure problems. It will decrease also the rate of performing open heart surgery, because most of the time when the patient has many problems associating the heart, if a patient has a valve problem and a coronary bypass problem, we technically we don't perform minimal invasive cardiac surgery in most of these patients. Instead, we perform the open heart surgery. But if the patient has only isolated coronary artery bypass grafting, we are able to fully perform minimal invasive cardiac surgery. Or if the patient has a valvular problem, we are also able to perform the fully minimally invasive cardiac surgery. So I truly believe that the rate of open heart surgery will decrease as the technology increases and the widespread of the 3D system and robot increases in the future. The future of cardiac surgery is very bright, especially with minimal invasive cardiac surgery and the introduction of artificial intelligence, which will enable us to perform the pre-operative planning and help us to plan very well before we do the surgery, will enable us to perform very, very safe surgery and have a very success rate of this minimal invasive cardiac surgery. So I truly believe the future of future of cardiac surgery is very bright, especially with the robot, especially with the 3D scope and with the artificial intelligence, which will help us in pre-operative planning and help us perform safely and plan safely and have a very successive post-operative results, which affects most of the time mobility and mortality. So I do thank you very much for having me, and I hope we will meet next time. Thank you very much and have a nice program.